We will study arteries and nerves. We will speak a lot about these openings because vessels and nerves pass through these openings. Today only names: foramen ischiasicum major and foramen ischiasicum minor. Now, pelvis as a whole. When we speak about pelvis as a whole, necessary to know sizes of large pelvis and true pelvis. Large pelvis, that is everything what is above of linea terminalis. Linea terminalis consists of promontorium, linea, what is this line, who remember? Arcuata in pelvic bone, eminentia iliopubica, pecten ossis pubis, and upper part of pubic symphysis. And here it is the same: promontorium, linea arcuata, eminentia, pecten ossis pubis, and pubic symphysis. That is, all these structures together surround linea terminalis. And this linea terminalis, that is a border between large pelvis and true pelvis. Necessary to know sizes of large pelvis and true pelvis. If you measure this space between spina iliaca anterior superior, it is easy to do with the help of this pelvic measure, that is distance between two spina iliaca anterior superior, that is distantia spinarum, distance between anterior superior spine. Clear it is. It should be 25 till 27 centimeters. Next distance, it is distance between spina iliac crest, that is crista iliaca, that is iliac crest here and here. And it should be 29 centimeters in normal. And last distance, it is distance between greater trochanter. Here it is, help me, good. That is trochanter major on the right side and the same trochanter on the left side. And if we measure this distance, that is distantia trochanteric distance, it should be 33 centimeters. That is sizes of large pelvis, but it is not so interesting, because more interesting to know sizes of true pelvis, because it is important in which time? Delivery, yes, because if it is necessary to decide, is it possible to pass of baby through true pelvis, or necessary to make operation cesarean section. Clear it is. And here it is in true pelvis, necessary to know distance of inlet and distance of outlet of true pelvis. In inlet, we have direct or straight size of true pelvis and transverse size. This space between promontorium and middle part of pubic, that is middle part of pubic symphysis, that is smallest distance, and name of this distance is conjugata vera, true conjugata vera. It is 11 centimeter. How to found this distance? We can measure space between external side of pubic symphysis and point below of spinal process of fifth lumbar vertebra. And this space has name conjugata externa, external direct size. And if this size is near of 21 centimeter, and we minus thickness of pubic symphysis and thickness of sacral bone, it is near of 10 centimeters. 21 minus 10, and we receive 11 centimeters, that is conjugata vera. Or another way, in time of in time of, through vagina, if we insert fingers into vagina and try to attach promontorium, this distance from lower border of pubic symphysis and promontorium, that is 12 or 13 centimeters, and minus 1.5 2 centimeters, we receive conjugata vera. That is more exact, more correct possibility to measure the conjugata vera through vagina in time of intravaginal examination. That is, this distance between promontorium and lower part of pubic symphysis has name conjugata diagonalis, and minus 1.5 2 centimeters we receive conjugata vera. How to find transverse distance of pelvic inlet? We found distantia cristarum. We said that it is 20h 29 centimeters, distance between iliac crest, 20h or 29 centimeters, and subdivides this distance into 2. That is 20h divided into 2, we receive 14 centimeters. 14 centimeters, that is normal size of transverse size of pelvic inlet. Pelvic outlet, it is the same direct size between apex of coccyx and lower part of pubic symphysis. That is direct size of pelvic outlet, the same 11 centimeters, and space between both tuber ischiadicum, here and here. This distance is 9.5 centimeters, but it is, when we measure this distance in living woman, it is skin, subcutaneous fat. That is why if you measured it is 9.5 centimeters, you should remember that skin and fat, it is in time of delivery of fetus, it's attached to bones, and this space is larger in 1.5 centimeters. That is why this space, if you found with the help of this pelvic measure 9.5 centimeters plus 1.5 to skin and fat, and you receive the same 11 centimeters. That is transverse distance of pelvic outlet. 11 centimeters here, 11 centimeters here, 11 that is conjugata vera, and 14.5 centimeters, that is transverse distance of pelvic inlet. Now, joint between humerus, between femur and acetabulum. That is hip joint, articulatio coxa, because hip bone is os coxa and this joint is articulatio coxa. This joint is, help me, simple or compound? Simple, because one bone is hip bone, acetabulum of hip bone, another bone, head of femur. Simple. Then shape is spheroid. It is a type of spheroid joint, cotyloid joint, ball and socket joint, and multiaxial. It is simple, spheroid or cotyloid joint, and multiaxial. Like in shoulder joint, main axis of movement are frontal, flexion and extension, sagittal, abduction and adduction, and vertical axis, that is pronation and supination. Together, circumduction. Ligaments. Two ligaments inside of this joint, intra-articular, two intra-articular ligaments. One ligament starts from fossa acetabuli, and attached to fovea capitis femoris, that is ligamentum capitis femoris. Another ligament is above of incisura acetabuli, above of this notch, that is ligamentum transversum acetabuli. They are two intra-articular ligaments. Ligamentum capitis femoris, it is very important ligament. Because through this ligament, vessels goes to the head of femur and supplies it. If in time of fracture of the neck of the femur, if this ligament broken, fracture not fused together, head not fused with the neck of the femur, because blood supply of the head will blocked because ligament is broken. If this ligament not broken, it's possible fuse together this head with the neck of femur. Clear it is very, very important ligament. And for extra-articular ligaments, one of them start from pubic bone and goes to femur, that is ligamentum pubofemorale, from here to here. Another start from iliac bone and goes to femur, that is ligamentum iliofemorale. And last, start from sciatic bone and goes to femur, ligamentum ischiofemorale. Clear it is not difficult. Pubofemorale, iliofemorale, and ischiofemorale. And last ligament is zona orbicularis. This zona starts from spina iliaca anterior inferior, surround neck of the femur, and attach the same to this spine, like loop. Surround neck of the femur and attach here. That is zona orbicularis. Zona orbicularis. 4 ligaments, 3 from each bone, and 1 is zona orbicularis. They are extra-articular ligaments of hip joint. That is all. Articulation of pelvic bones, pelvis as a whole, necessary to know sizes of pelvis, and hip joint. Next time. Have you got any questions? I promise to show you corp. Not a problem.